Okay, good day class. So for today, we're going to discuss about the mtap cc2 midterm rationalization of the questions by yours truly. Okay, now let's proceed to mga questions. For questions number 26 to number 29, you would answer this by looking at the information given by the table. Okay, for number 26, ang tanong niya, which of the following enzymes catalyzes through hydrolysis or via splitting chemical bonds by the addition of water molecules? So from this point, malalaman nyo na agad na ang tinutukoy ng question natin is hydrolase. Diba? Kasi splitting chemical bonds by the addition of water. Now, how do we answer that? If you remember my lecture back then, whenever we look at the nomenclature or yung mga enzyme codes, yung first digit would indicate yung kung anong enzyme group siya. Okay? Diba yung 1, ito 1, that is oxidoreductase, wherein redox reaction yung catalysis niya. Number 2 is transferase, yung nagka-transfer of chemical group from one substrate to another. And number 3 is hydrolase, yung hydrolysis of a bond by the addition of water. So basically, enzyme B is the answer for this particular question. Tatuloy pa natin. Number 4, lyase, removal of bonds without hydrolysis. Tapos meron tayong 5, which is the isomerase, intramolecular arrangement ng mga enzymes. Yun yung kinakatalyze niya. And then number 6, syempre, yun yung ligase, yung joining of two substrates. So number 27, in the current situation, which among the enzymes start to denature its protein structure? So to answer this, we look at the temperature nila. Now, we all know the optimal activity is 37 degrees. So basically, this one, malapit na siya sa optimal activity. So basically, hindi siya nagde-denature. So letter A is not the answer there. Next, B, sabi niya, 25 and up. So basically, dito pa lang nag-i-start yung enzymatic reaction activity. Papunta pa lang siya dun sa dun sa optimal temperature for enzymatic activity. Okay, so hindi pa yan nagde-denature. Yung letter C, we all know that yung inactivity of enzymatic reaction starts at 60 to 65. So basically, inactivated na yung enzyme at this point. So dito, X din yan. So the correct answer is letter D. So letter D is the correct answer since the start of the enzymatic denaturation or protein denaturation of enzymes, it starts at 40 degrees Celsius to 50 degrees Celsius. Okay, so the answer is letter D. Next, number 28. Looking at the pH situation of the enzymes, enzyme B or alkaline phosphatase will have, so ano ba yung mga choices? A pH for maximal activity, a pH for minimal activity, C, an inactivation of enzymatic activity due to severely high pH, or letter D, protein denaturation of enzymes due to highly basic pH. So, check mo muna natin yung enzyme B at saka yung pH, current pH status niya. So, enzyme B, ang pH niya is 9.0. So, very alkaline. So, we all know that most enzymes reacts at pH 7, okay? Ano kasi? pH 7 to 9, okay? So, most enzymes react to pH 7 to 8 pala. Okay, sorry. To 8. However, alkaline phosphatase is basic enzyme. Nasa pangalan niya na mismo, alkaline phosphatase. So, basically, it's a highly basic enzyme. Okay? Hence, yung pH niya for a optimal activity or maximal activity would be pH 8 to 10. Okay? So, since nasa pH 9 siya, no, the current pH niya is pH 9, nasa maximal activity ang enzyme na to. Okay? So, similarly, yung acid phosphatase, no, since it is an acidic enzyme, so yung pH niya would be 4 to 5. Okay? Yung acid phosphatase. Okay? So, most of the enzymes, nagre-react sila or yung maximal activity nila is 7 to 8. Pero yung alkaline phosphatase is 8 to 10 since it is basic. And then acid phosphatase is 4 to 5 since it is acidic. So, the answer for number 28 is a pH for maximal activity. Okay? Next, number 29. Number 29, choose the enzyme which has an inhibitor that is structurally similar to the original substrate, thereby deceiving the enzyme in the process. So the answer here is the competitive inhibitors, which is letter C. Okay, so why? Since sabi ni Bishop, competitive inhibitors physically bind to the active site of an enzyme and compete with the substrate for the active site. So, yung inhibition dito is reversible, no? Unlike the other inhibitors. Bakit siya reversible? Because the substrate, yun nasa question mismo, no? Sabi niya dyan, the substrate is more likely than the inhibitor to bind the active site and the enzyme has not been destroyed. So that is the answer for number 29, which is letter C. Okay? Now, next, for numbers 30 to 32, we have a case. Sabi dito sa vignette, Angelo Mima daw is a medical technologist working in the clinical chemistry section of a laboratory utilizing the spectrophotometer as their main equipment. She then received a specimen from the phlebotomist with the physician's requisition form. The request is as follows: AST, ALT, LDH, and CKMB. The patient did not conduct any preparations prior to the sample collection, hence the patient took his normal meal and the blood collected appears to show some signs of hemolysis. Okay, so basic question number 30, which among the blood samples anticoagulants is the most acceptable for the above mentioned tests? So ano ba yung mga tests? So enzyme tests, AST, ALT, LDH, and CKMB. So, since you are all interns right now, alam niyo na to. So, correct kayong lahat dito, I'm pretty sure. The answer is no anticoagulant needed or required. Okay? It's either yung red top tube or pwede rin naman yung gold top, yung with gel separator. Diba? Okay, so, that is the answer. Okay? So, bakit nga ba the best or most acceptable would be no anticoagulant? Whereas, di ba, pwede tayong mag-lithium heparin sa ibang mga test dito. Pwede rin tayong mag-oxalate for other enzymes. So, the main reason here is that yung there are multiple tests involved, and the most suited or the most suitable anticoagulant is the no anticoagulant at all. Okay? So, number 31, where should the medical technologist expect the storage for the LDH reagent? So, saan niya daw makikita yung LDH reagent? So, the negative 20 degrees Celsius na storage, ginagamit lang yan for the preservation for a longer period of time. So, basically, if that particular enzyme reagent is rarely used or rarely utilized, doon mo siya ilalagay. Otherwise, ilalagay mo siya sa 2 to 8. So, most of the enzymes, the ideal storage temperature for substrates and coenzymes is the refrigeration temperature, which is the 2 to 8 degrees Celsius. However, babalikan natin yung question, hinahanap is the LDH reagent. the ideal storage for the lactic dehydrogenase is room temperature. Okay, so room temperature, which means 21 to 25 degrees Celsius. Okay, so that is the correct answer, letter C. Ano naman yung 37 degrees Celsius? Siyempre, yan na yung gagamitin ng mismong machine na temperature for the maximal enzymatic activity nung kanyang mga tinetests. Okay? Assume that the medical technologists decided to proceed the routine testing of the blood sample despite the presence of pre-existing factors. Choose among the following which is the expected effect to the results. First and foremost, as you can see, nakita niya na meron ng signs of hemolysis. Doon pa lang dapat hindi mo na tinest yung tawag dito, yung request, 'di ba? Yung request ng physician. Another thing is the patient took his normal meal. So basically, some procedures kasi in some laboratories may mga specific guidelines or patient preparations for these particular tests. However, meron din namang mga laboratories or machines itself that does not require fasting or any patient preparation. So dito, kahit hindi mo na i-consider yan, as long as makita mo lang to, hemolysis, dun pa lang, kahit hindi mo na siya tanggapin. And bakit mo siya hindi tatanggapin? Kasi nga, gumamit siya ng spectrophotometer, which most likely would interfere to the result of your enzymatic activity. So, the answer here is because of hemolysis, magkakaroon ng falsely increase the result of enzymatic activity. So, yan. Letter A. So, bakit? The main reason is that the RBCs, no? Kasi nga hemolyzed sample, so may mga erythrocytes, mga lysed or degraded na erythrocytes na nagsiswimming dun sa serum sample, no? Yung mga RBCs na yun, which lysed, releases intracellular contents. And yung mga contents na yun, they sometimes have the enzymes themselves. Okay? So, so basically, nag-i-increase yung enzymatic activity or enzyme result. Okay? For number 33, choose among the following enzymatic activity measures. Quantify enzyme concentration by mass and routinely used for the assessment of CKMB enzyme activity. So, ito napakadali lang nito. You just go back to your laboratory sa institution kung saan kayo nag-i-intern, then assess kung ano ginagamit for CKMB. And you would notice na almost all, since it is the routinely used, ang ginagamit nila is immunoassays. Okay, as the principle. So, methods for the measurement of CK isoenzymes. So, lahat, no? MB, MM, tsaka yung BB, tsaka yung CK total, no? Include ion exchange chromatography, immunoassays, tsaka yung immunoinhibition methods. However, yung immunoassay is routinely utilized because it measures with the minimal cross-reactivity. Mababa yung cross-reactivity rate nun, no? And immunoassays measure the concentration of enzyme protein mass rather than the enzymatic activity. Please take note of that, no? Mini-measure ng immunoassay is yung protein mass instead of the enzymatic activity. Kaya nga meron siyang minimal cross-reactivity. Ma-limit na makuha mo yung resulta ng CKMM sa CKMB mo, no? Since kung gusto mo lang makuha CKMB, yung protein mass lang ng CKMB yung i-detect ng makina mo or ng immunoassay principle. So therefore, it can also detect enzymatically inactive CKMB. Okay, next. So number 34, chief cells of the stomach release pepsinogen. Upon reaching the stomach acid, pepsinogen is then converted as pepsin. What is the enzyme specific term which refers to pepsinogen. So, ano daw si pepsinogen? So, we all know that pepsinogen is considered as an inactive zymogen, no? Since hindi pa yan yung actual enzyme na mag-act. So, kailangan niya pang dumaan sa further metabolism at saka conversion bago siya maging active zymogen, which is yung pepsin nga. Okay? Now, isa-isahin natin. Pag sinabing apo enzyme, it means that it is an enzymatically inactive part of an enzyme which requires substrate to be active. So basically, this is is a part of an enzyme, no? Na kailangan pa ng katuwang bago siya maging active, no? Kailangan niya pa ng substrate. Yan yung part na kailangan didikitan ng substrate para maging active yung enzyme na yun. Next holoenzyme, it is the enzymatically active form when the enzyme and coenzyme bind. So, pag nagsama na yung enzyme tsaka yung coenzyme niya, no, pwede na siyang makipag-bind sa kani-kanino mang substrate para maging siyang active as well. Next is the letter D muna tayo. Isoenzyme. So, this is the, alam na natin, pag iso, ibig sabihin same. So, same enzymatic reaction but different forms. And pepsin, meron siyang 8 isoenzymes. And ano yung pinaka-dominant isoenzyme ni pepsin? It is the P3. Okay? So, take note of that. The most dominant isoenzyme of pepsin is P3. Okay? So, the answer here is proenzyme. Bakit? Pepsinogen in this scenario is considered as a proenzyme because it is the inactive form of an enzyme before metabolism or conversion. Okay, huwag nyo kayong papalito, no? Proenzyme, inactive form ng enzyme bago siya maging active. Pag sinabing apoenzyme, inactive part, no? Part lang siya, parte lang siya ng enzyme. Okay? So, ito, ang sagot is letter C. Next, number 35, choose among the principle of methods mentioned below best describes amyloclastic method of determining the enzymatic activity of amylase. So, lahat to ay mga methods on determining the enzymatic activity of amylase. And lahat lang yan, ang ginagamit nilang substrate is starch. Okay? Take note of that. Lahat ng all of the methods, no, for the determination of enzymatic activity of amylase, they all utilize starch as their substrate. Ang pinagkaiba lang nila would be yung measurement nila, yung method of measurement nila. So, letter A is sacharogenic, no? Kasi reducing sugars, dun pa lang makikita nyo na. So, sacharogenic yan. So, hindi yan yung amyloclastic. Letter C is chromogenic. Kasi nga, color intensity ang tinutukoy. Okay? Letter A, sacharogenic kasi mga reducing sugars. Letter C is chromogenic since color intensity. And letter D is the coupled enzyme, no? Kasi meron siyang continuous monitoring technique, that is the coupled enzyme, which leave us sa letter B. Kasi nasa pangalan niya na mismo, yung amylase activity, di ba? Yung direct siya dun sa amylase activity. So this is the answer, letter B. Okay, so for number 36 and number 37, meron tayo ulit case, no? A patient came to the ER complaining of severe needle-like pains around the left upper quadrant area of the body for almost a day now. The resident physician on duty requested a STAT, serum amylase and lipase test for the patient. So upon processing the patient's blood sample, The results were as follows. Yung amylase niya, mataas. Lipase, mataas. So, the patient was admitted and had his blood reworked after 5 days, in which the results were yung amylase, it went back to normal, whereas yung lipase, it remained high. Okay? Pero bumaba ng konti. Pero mataas pa din. Now, yung questions sa number 36 and 37, pagsamahin natin. 36, looking at the patient's enzymatic activity results, what is the most probable diagnosis? The answer is acute pancreatitis. Tapos the number 37, the enzymatic activity level of amylase in the patient at 24 hours or yung initial blood collection is considered as, the sagot is peak levels. Okay, now, let's rationalize. Okay? So sabi ni Bishop and Henrys, ang acute pancreatitis, yung amylase mo, no, magra-rise yan ng 2 to 12 hours. Okay? Tataas. And then yung peak levels niya, pinakamataas na levels, ay nasa after 24 hours. After a day. And then yung normalized niya is 3 to 5 days. Okay? Now, yung lipase, so this, ang pinag-usapan natin dito ay acute pancreatitis. Okay? Ang lipase, on the other hand, rise, peak, normalize. Yung rise niya is after 6 hours. Yung peak niya, sabay sila ni amylase, which is 24 hours. And then, it remains elevated for 7 days, for a week. And then, magno-normalize lang siya after 8 to 14 days. Okay? Now, why is the answer acute pancreatitis? So, as you can see, after 5 days, diba, nag-rework siya ng 5 days. We all know na after 24 hours for a day now, sabi niya, for a day now. So, ibig sabihin, after 24 hours, ito yung results niya. Mataas na amylase, mataas na lipase. And then after 5 days, nag-normalize na, ayan, normalize yung amylase, whereas yung lipase, it remained elevated kasi wala pa siya dun sa 8 days na normalize niya. So the answer here is acute pancreatitis. Tapos yung sagot sa number 37, sabi niya, the enzymatic level of amylase in the patient at 24 hours. So, alam natin yun. Pag 24 hours, tas ganun yung value niya, that is the peak levels. Okay? Now, pag chronic pancreatitis yan, that means, nasa pangalan na mismo, chronic. That means, matagal, no? The amylase and lipase levels remains elevated as long as the pancreas remains inflamed. As long as namamaga yung kanyang pancreas, mataas ang value or yung results ng kanyang amylase and lipase. Pag naman intestinal obstruction, yung levels may be normal or below normal range kasi may nag-obstruct may nakaharang. And since may nakaharang, yung release ng mga enzymes na to to the bloodstream, nahaharangan din. Okay? Hence, the levels may be normal or below normal range. And lastly, pag ectopic pregnancies, levels of amylase are increased. However, yung lipase, it remains normal. Okay? Next. Alright, so next is another easy question. Sabi niya, which of the following enzymes is generally associated with ATP regeneration in contractile or transport systems? And where does its predominant physiologic function occur? So, syempre, the answer here is walang iba kundi creatine kinase. And the predominant physiologic function niya, it occurs in the muscles. Specifically, sa skeletal muscles, yung heart muscle, saka sa brain. no? So, sunod-sunod lang yun. It is predominant sa skeletal muscle, and then sa heart, or yung cardiac muscle, tapos sa brain. Okay? Next. Okay, so ito medyo complex to, no? So, you listen carefully. So, number 39, gamma-glutamyl transferase, or GGT, is an enzyme involved in the transfer of gamma-glutamyl residue from gamma-glutamyl peptides to amino acids, water, and other small peptides. Choose among the following the most common source of gamma-glutamyl donor in the human body. Okay, yung tinutukoy is human body, hindi yung chemical reaction outside the body which is ginagawa sa laboratory. So, ang hinahanap dito is yung normal biochemical reaction sa katawan natin. Okay? Okay, wait. Okay. Yung letter A is the acceptor in the enzymatic reaction of GGT in the outside of the body, or in the chemical reaction niya mismo. Okay, that is the glycine. So, acceptor siya. Okay? Yung B naman, that is the substrate of the enzyme GGT in the human body. Okay? So, yan yung ginagamit niyang substrate. Papalitan mo lang yan ng letter N, no? Yung from amide, gagawin mo yung amine. So, magiging siya nitroaniline. Yun na yung ginagamit outside the body. Okay? So, gamma-glutamyl para-nitroaniline is the donor in the enzymatic reaction of GGT outside the body. Okay? Inside the body, ang donor is nitroanilide. Okay? Now, letter C is the end product of GGT enzymatic reaction of GGT, which is the para-nitroaniline. So, yan na yung nagiging end product dun sa reaction. Ibig sabihin, ito na yung color reaction niya. Yan yung end point. Diba? Yan yung magde-develop ng color sa outside of the body, once again. Okay? So, ibig sabihin, meron tayong glycine plus yung gamma-glutamyl para-nitroaniline, tapos in the presence of GGT, so yung letter A plus letter B in the presence of GGT, meron pang isang substance dito, and yung letter C. So, yan yung end product. So, yan yung nangyayari outside the body. Okay? Now, inside the body, the answer is letter D. Glutathione, which is nasa liver. Okay? Glutathione is the most common source of gamma-glutamyl donor in the liver. And then, if you want to read more about this, nasa Bishop yan. You just look at the GGT enzyme, tas basahin nyo dun. Okay? Next, number 40. A doctor ordered LDH electrophoresis for his patient suffering cardiac necrosis. The physician wants to confirm if the AMI is involved in his patient's current condition. He remembered that a flip pattern is the best way to confirm his diagnosis through LDH electrophoresis. Which of the following shows the flip pattern? Sandito. So, before you know the flip pattern, first, kailangan mo munang makilala sino dito sa mga choices. Yung normal LDH isoenzyme electrophoresis na normal. Diba? So, the normal here is letter D. LD2, followed by LD1 and 3, 4, and lastly, yung 5. Okay? So, saan dito yung AMI or flip pattern? Magbabaliktad yung 1 and yung 2, which is yung letter B. Okay? So, bakit letter B, hindi letter C? Letter C kasi, pantay sila. Hindi sila pantay. Okay? In other books, you would notice na sasabihin nila they are pantay. No? Yun ay dahil sa, if you're going to look at the actual electrophoresis result, yung graph mismo, no? Kung titignan nyo sila, macroscopic or ano yung on your sa mismong mata mo, no, makikita mo sila parang pantay sila, pero if you were going to quantify them, mas lamang si LD1, no, when it comes to a flip pattern. So hindi sila pwedeng maging pantay for AMI. Okay, yung ratio niyan mas mataas yung LDH1 kaysa sa LDH2. So, the only answer here is letter B. Now, yung A and C, wala yan. Walang ganyan. For liver damage, take note of this. Okay? Ang una is si 4, and then si 2, tapos si 1, then si 3, and then si 5. Yan yung electrophoresis niya. Pag naman skeletal muscle damage, ang magiging ano dyan is 5, 1, 5, 2, 1, 3, and 4. Okay? So, that is the tayo dito, electrophoresis. LDH, isoenzyme electrophoresis. Okay? Okay? Number 41 is another easy question. So, choose among the following mechanisms does the electrolytes utilizes whenever there is a passive movement of ions across a cellular membrane in which it also depends on the size and ionic charge through which it is passing. So, itong cellular fusion and cellular fission, walang-wala na yan. So, siguradong walang-wala na yan since hindi naman cells ang mga electrolytes. So, ano na lang natitira? Active and diffusion. Okay? So, both of these choices, both of these choices, they answer or they, anong tawag dito? Pareho sila na movement of ions across a cellular membrane na nagdedepende sa size and ionic charge. The only difference is that yung diffusion is a passive movement, whereas yung active transport, that is an active movement. So, the only answer here is letter C. Kasi nga sinabi dyan, a passive movement of ions. Diba? So, diffusion of electrolytes is due to a tendency ng mga ions to move towards points of a lower concentration, while their charge causes a gradient of potential which makes both ions move with the same average velocity. Okay? Number 42, who among the patients above is most likely to have normal and regulated plasma osmolality levels? So, the answer here is only letter C. Since letter A, B, and D, lahat sila nagsasuffer sa diabetes insipidus. No? Tatandaan nyo that the arginine vasopressin hormone or the ADH, no, or yung antidiuretic hormone, it promotes water retention or reabsorption once na yung body mo na-detect niya na kulang ka sa fluids or water. Along with that, nadedetect din ng kapag nagkulang ka sa fluid or water, na uuhaw ka din or yung thirst. Diba? So, paano pagtulog ka? So, pagtulog, yung ABP and ADH na yun. So, bakit nasabi ko na letter A, B, and D, they all suffer from diabetes insipidus? Pero different variations yung mga yan. So, patient A most likely suffers from a central or yung hypothalamic or yung cerebral or yung true diabetes insipidus because meron siyang excessive water excretion, no? Polyuria. But despite of this, the patient's inability to produce AVP and ADH due to a problem in the hypothalamus or the pituitary gland. Nagko-consume siya ng water, nag-excrete siya na nag-excrete, nababawasan siya ng fluid, so dapat gumana na yung AVP na or ADH. However, since sira yung or may problem dun sa kanyang hypothalamus or pituitary gland, hindi nagpo-produce ng AVP or ADH. So, this is the true diabetes insipidus or yung central diabetes insipidus. Okay? Next, yung letter B, yung B naman, most likely it suffers from nephrogenic naman. Okay? So, what do we mean by nephrogenic? Nephrogenic in diabetes insipidus, as you can see, gumagana yung kanyang hypothalamus at saka yung kanyang pituitary gland. Nag-i-increase yung AVP and ADH kasi nga nagkakaroon ng excess urine excretion, polyuria. Okay? Now, since gumagana naman, the problem here would be the the kidneys, no? Hindi nagre-respond ng maayos yung kidneys, kaya nade-detect ng utak niya na nauuhaw ka pa, inom ka pa, so water consumption pa rin. Kaya lang may problem yung kidneys niya, nare-retain yung mga fluids, hindi nare-retain yung mga fluids or yung water sa katawan niya, nilalabas ng kidneys because there's a problem sa kidneys. Even though there's already an increased AVP and ADH, hindi makapag-respond yung kidneys niya ng maayos. Hence, nagre-release ng urine. Okay? Now, yung patient D most likely suffers from dehydration plus meron din siyang diabetes insipidus. So, kawawang-kawa. So, uhaw na to. Okay? And then, urine volume deficit. And again, hindi gumagana yung kanyang pituitary gland as well as yung hypothalamus. So, ano klaseng diabetes insipidus to? True or central or nephrogenic? So, the answer is, it is A, central diabetes insipidus or true in diabetes insipidus or cerebral or hypothalamic DI. Okay? So, only patient C has a normal and well-regulated plasma osmolality levels. Okay? So, next, fractional excretion of sodium is best used to distinguish between acute tubular necrosis and which of the following. So, fractional excretion of sodium, hindi yan lab procedure or a test. It is a calculation of the amount of sodium na na-excrete by the urine over the amount of sodium na na-filter or na-reabsorb. So, hence, or therefore, it is best used to determine if the drop in urine production is due to the reduced blood flow to the kidney or maaring yung meron ding damage yung kidney mismo. No? The kidney, it is due to the kidney damage itself. So, how do we compute that? The answer is ganito. So, FENA is equal to yung urine sodium over over the serum sodium multiplied by serum creatinine over urine creatinine. Okay? Multiplied by 100. Ang gulo, no? Pero ulitin ko. So, fractional excretion of sodium, to compute urine sodium over serum sodium multiplied by serum creatinine over urine creatinine times 100. So, similar siya dun sa formula ng AC ratio, if you remember that. To calculate yung amylase and creatinine ratio. So, palitan mo lang yung sodium na yan, gawin mo amylase, meron ka na AC ratio. Okay? So, similar lang sila. Now, sabi nga kanina, ginagamit siya to determine yung drop in urine production is galing ba yan sa reduced blood flow or ng kidney or kidney damage. So, syempre, sino ba yung pinaka primary problem here would be yung urine flow. It is yung letter A, pre-renal azotemia. Azotemia, diba? So, letter A. So, a 35-year-old patient named Shasmina Lights Malayari was admitted to a hospital following 3 days of severe vomiting. According to her history, she was reportedly normal and healthy prior to the episode. Physical findings show decreased skin turgor or yung elasticity and obvious dry mucous membranes. Her lab tests were as follows. So, yan yung mga values natin. So, napakadali lang nito. And si Bishop, nag-introduce siya ng 2 formula per each dito. So, ginamit ko yung dalawang yun para at least kahit anong gamitin nyo, you could choose the best answer. So, osmolality muna tayo. So, osmolality ganito. So, 2 times sodium plus yung glucose over 20 plus BUN over 3 equals. Okay? So, yan yung isa sa mga formula to compute osmolality. Yung isa, ganito yan. 1.86 multiplied by the sodium plus yung glucose over 18 plus BUN over 2.8 plus 9. Okay? So, yan yung dalawang formula. And sabi ni Bishop, both are acceptable naman. However, yung second one, yung 1.86 sodium, mas accurate siya and mas ginagamit siya in the laboratory. Regardless, both of them naman, they are acceptable. Okay? So, you can pause the video and then you can compute it yourself kung gusto nyo. Okay? Now, kung okay na, the answer here sa taas would be 269.2. Yung kabila naman, the answer is 261.13. Okay? If nakuha nyo yun, you would notice that the best answer or yung closest answer ng computed values natin would be letter B. Kasi pasok dun yung 261 tsaka yung 269. So, letter B. Now, let's compute naman yung anion gap. Again, meron dalawang possible formula na binigay si Bishop. So, gagamitin natin yung dalawang yun. Okay? Yung first one is, napaka-basic lang. Sodium minus chloride plus HCO3 bicarbonate. Okay? So, basically, lahat ng cations nasa left. Lahat ng anions nasa right. So, ganun lang siya kasimple. Okay? Yung pangalawa naman is, kung available daw yung potassium, sama mo dyan. Chloride plus bicarbonate. So, ganyan lang kasimple yun. Okay? Now, you can pause the video again if you would like to compute. And then, pag okay na kayo, so here are the answers. The answer sa first formula is 43. And dun sa second formula, answer is, nawala. The answer is 48. Okay? So, 43 and 48. So, as you can see sa mga choices, the only acceptable answer here is letter C. Okay? Next. Okay, number 46. During metabolic acidosis, there is a reduction of pH levels. So, what should the hydrogen ion as well as the potassium ion do to maintain electrolyte balance? So, ang tinutukoy dito would be the acid-base and potassium homeostasis. Acidosis means there's too much hydrogen ions in the circulation. So, kailangan magkaroon ng exchange between the hydrogen ion tsaka yung potassium ions sa ating mga sa bloodstream tsaka na sa mga cells, di ba? And this is regulated by the ATPase activity. Okay? So, metabolic acidosis, nagkakaroon ka ng decreased potassium, di ba? Hypokalemia. No? Kasi, nagkakaroon ng hyperkalemia. Kasi, decreased potassium excretion, tas increased yung potassium reabsorption. So, to compensate, the body will instruct the cells to move the hydrogen ions intracellularly, tapos yung mga potassium ions ilalabas. Okay? So, on the other hand, metabolic alkalosis increased yung potassium excretion. Linalabas lahat. So, hypokalemia. Decreased yung potassium reabsorption. So, to compensate, the body will instruct the cells to move the potassium intracellularly. Baliktad naman, whereas yung hydrogen ions, lalabas sila. Okay? Basta tatandaan nyo lang, hydrogen ions, directly proportional yan sa acidity ng pH. Okay? So, yun na yan. Number 47 is another easy question. 47, an ER doctor immediately called the laboratory for a stat blood collection and a stat request for magnesium determination. So, yun lang yung parameter na gusto niya malaman. So, the clinical chemistry staff on duty prepared the machine which is capable of running either a serum or plasma samples ng magnesium. And task you, the intern on duty, to extract the blood located in the other building. No, napakalayo, pangit yung construction ng institution na to. And then you brought your warding box. However, upon reaching the emergency room, you forgot to bring a gold top nor a red top. So, wala ka nung mga for serum collection. Okay? On the other hand, you're bringing other anticoagulant tubes such as yung oxalate, citrate, EDTA, tsaka lithium heparin. What should you do in this situation? Siyempre, maling-mali na yung letter A and letter B. Since you would the basic phlebotomy etiquette na tinukoy sa MLSP nyo. MLSP ba yan? Yes, MLSP. Sabi no, universal precaution sa CPH, di ba? Universal precaution. So, you treat all your specimen as infectious. So, if you run, there's a high risk na matapon yung specimen or magkapalit-palit, no, yung mga specimen, or maaari ding ma-hemolyze. So, maling-mali yun. So, the only answer here is letter D. Okay? Collect the blood and then prioritize lithium heparin for the magnesium. Bakit hindi pwedeng yung oxalate? Yung oxalate kasi, it binds to magnesium or any other minerals, no? And alam naman natin na most of the electrolytes, halos silang lahat minerals sila. So, napaka-pangit niya oxalate, no? So, kung magbabind yung oxalate sa mga minerals, anong magiging result? It will be falsely decreased yung result natin for electrolytes. Okay? Number 48, which of the following patients will have an expected decreased ionized calcium levels in their serum? So, yung letter A dyan, nagsasuffer siya ng breast cancer. So, there will be mild increase of ionized calcium. Patient B naman, suffering from pulmonary sarcoidosis, elevated yung ionized calcium niya. So, mataas na naman. Patient D, who excessively spent too much time in the sun. So, mataas yung vitamin D niya. And we all know na yung vitamin D, it is responsible or it influences the calcium production in our body. No? So, mag-i-increase din yung ionized calcium dyan. So, the only answer here is letter C, since the patient C is suffering from primary hypoparathyroidism. So, primary hypoparathyroidism, didecrease yung ionized calcium levels as well. Now, take note that yung secondary hypoparathyroidism, no, nagdi-decrease pa rin yung ionized calcium. So, kailan lang siya nagpabago? Tatandaan nyo na yung sa parathyroidism, ang main na problem dyan would be the parathyroid hormone or the PTH. And yung pinakatrabaho ni PTH is the suppression, no? Pipigilan niya yung calcium excretion. Ibig sabihin, mas marami yung calcium in the circulation. So basically, kapag hypoparathyroidism, diba, walang pumipigil kay calcium, ibig sabihin, tataas yung calcium levels natin. Okay? Next. 49. Patient X is a non-dialysis patient currently diagnosed with chronic hyperkalemia. She has been suffering from an impaired renal excretion of potassium. Renal insufficiency is also observed primarily due to a tubulointerstitial disease. Her aldosterone level findings have shown to decrease drastically. With all conditions mentioned above, which of the following is the most likely cause of her chronic hyperkalemia and aldosterone deficiency? So, ang sabi dito, meron siyang, impaired renal excretion of potassium. May problem sa pagre-release or paglalabas ng potassium sa katawan. No? Ibig sabihin na nare-retain sila sa body. So, hyperkalemia. No? Dito. So, potassium remains in the circulation. Nagkakaroon ng hyperkalemia. And then, meron din siyang renal insufficiency. Okay? So, ang tawag sa other name for renal insufficiency, we all know naman, hyporeninemic. So, dun pa lang, may idea na kayo. Tapos, ano pa yung nasabi dito? Aldosterone deficiency. So, basically, decreased aldosterone levels. So, pag samahin mo lang yung dalawang yun, you have the condition which is the hyporeninemic hypoaldosteronism. Okay? Next. I think this is the last one. In the determination of chloride through mercurymetric titration or Shales and Shales method, which of the following is expected end product of the chemical reaction? So, mercurymetric titration, or otherwise known as your Shales and Shales indicator, is ang indicator niya is yung diphenyl carbazone. So, ito, indicator to. Okay? Whereas yung end product, which produces yung blue-violet color, yan yung mercuric chloride or yung mercury 2 chloride. Okay? So, mercury. Anong kulay? Ano yung end product? Ito yung end product. Anong kulay? Blue-violet. So, ano yung dalawang natira? Yung mercuric thiocyanate and ferric perchlorate, both are from spectrophotometric methods. Yung mercuric thiocyanate, nagpo-produce yan ng reddish brown. Yeah, reddish brown complex. Meanwhile, yung ferric perchlorate, nagpo-produce yan ng yellow colored complex. Okay? So, I think that's it. Meron pa ba? Wala na. Yeah. So, thank you. I don't think may email nyo na ako since my AUF mail is already down. Hindi na ako empleyado ng AUF. So, kung may questions kayo, you just send it to your CIs and then forward na lang nila sa akin on my personal email or my personal or any personal message. Okay, so that's it. Again, if you have any questions, don't hesitate You just send them to your TIs. So thank you and good luck to your finals. And ano pa masabihin ko? Like and subscribe and you ring the notification bell para ma-notify ka sa mga future videos ko. So that's it. Thank you and bye-bye.